What do you think about UWorld? Look, let me talk to you about UWorld. The biggest thing about NCLEX style questions is that NCLEX style questions are critical questions. They are used to stimulate your mind, and they're used to make you think about what you need to do to take care of your patient. And I'm pretty sure all your instructors will all tell you that same exact thing, is that you need to be able to make a good clinical judgment on what patient you would need to see first, or what is best for your patient, or when it comes to those good old select all that apply, or what they like to call the Satan questions, because they are the bane of everybody's existence, about knowing those things on how to answer those questions. So first tip, when it comes to answering questions, knowing the difference between first and best questions. I'll give you a prime example. Usually when we say first, it's in a systematic approach. It is a step 1, step 2, step 3, so on and so forth. So if I gave you an example of your patient is complaining of having difficulty breathing, what is the first thing the nurse should do? If I'm telling you what is the first thing I should do, it is the least to the most invasive, right? So if I say, what is the first thing that you should do? Should I lift head of bed, or should I give O2? Yeah, I see it. Yeah, a lot of head of bed, Yeah, because I want to lift the head of bed because I want the patient to be able to get that full expansion of their lungs, right? So they can get that oxygen exchange. If I don't have to give oxygen, then I won't, because oxygen is considered a medication, right? A lot of people don't realize that, but oxygen is considered a medication. Anytime that I have who should I see first, or what should I do first, just know that everything is in a systematic approach. When it comes to who do I see first? Who do I see first in regards to, do I do ABCs or massive hemorrhage? I have a patient with COPD who has a O2 saturation of 87%, who has an arterial bleed to the left femoral artery. Or I have a patient who is 17 years old who is having an asthma attack but has an O2 saturation of 92. Which one of those patients would I see first? First patient. COPD. Now remember, are we seeing them for COPD, or are we seeing them for the bleeding? Yeah, we're seeing them for the bleeding, because which one of these issues is going to cause them to die first? Am I going to die from bleeding out, or am I going to die from having an O2 saturation of 92 or 86? So just know, when it comes to first questions, who do I see first, or what is the first thing that the nurse should do? It is always in a systematic approach. Second tip, we'll talk about best questions. What is the best thing that the nurse should do? And everybody should know this phrase if you guys are in this part of school, or when you guys are about to graduate. If I could do one thing and leave, what would it be? And remember, that one thing before you leave is what will be the best thing to make sure your patient stays stable. Because I'll give you an example. What if, you're doing something and then they were just like, hey, we need your help, but you need to take care of your patient first. What's the best thing I could do to take care of my patient before they leave? Here's another good example. You have a patient who is 17 years old and complains of difficulty breathing. What is the best thing that the nurse should do? Remember, best. Should I lift the head of bed, or should I apply O2? Apply that O2, right? Because that is the best thing that I could do for that patient. If they had an O2 saturation of 92, and if I gave them O2, it could bring their O2 saturation up to 99. And then you could go handle what you need to handle and then come back. Remember, if I could do one thing and leave, what would it be? It would be to give the patient O2. When it comes to those questions, just make sure you guys remember the differences, because I know, at least for me personally, those were the things that killed me. And for all of my individuals who already work like as LPNs, or if you're a graduate nurse and you guys have been working like during the pandemic, remember that this test is perfect world. And a lot of you are going to answer like, that doesn't make any sense. And the reason why I say that is because that was the hardest thing for me to grasp. I was like, that doesn't make any sense. That doesn't happen in the real world. And that was, I believe, a lot of factors that caused me not to do well when I took the exam the first 3 times. Just make sure that you turn that real world switch off and you do that perfect book world, you're going to do fantastic. My third tip, select all that apply questions, the ones that are the bane of everyone's existence. I know it's mine. It used to be where it was never only one and it was never all of them. And when 2017 happened, it's either one, few, or all of them. Second thing, I want to go ahead and shut this myth down. They say that you can get partial credit on a select all that apply questions. That is absolutely false. You cannot get partial credit at all. It's either you get the whole thing right or the whole question's wrong. Trust me.
I wish that a select all apply was like partial credit. I probably would have passed the first time. You know what? This isn't about me, but I'm just saying.
Just remember that, right? That I'm shutting that myth down. They are supposed to be changing next year or 2023, somewhere in between that time. And then, hey, when that changes and all the NCLEX stuff changes, hey, I'll pop up on here and do another webinar and we'll try to do some updates, right? Here's some things to remember about select all apply. This is where knowing your content is paramount. The example that I like to give is the roles and responsibilities of the RN, the LPN, or LVN, or the CNA, or what they like to call the UAP, which is an unlicensed assistant personnel, right? So you need to know and understand who can do what. Who can teach? The RN. Can the LVN or LPN teach? No. The LPN or LVN can reinforce. They can reinforce what the RN teaches. Can a LVN or LPN give IV medications? No. Can a LVN or LPN give PO medications? IM medications? Can they give medications through a feeding tube? Absolutely. Now, can LPNs give blood? No. Who can give blood? The RN, right? Remember, with an RN, it's two RNs that have to verify when it comes to blood. And I know a lot of you guys are just like, man, this is like super simple. But when it comes to those select all that apply, and then it puts on one of those things like, hey, can the UAP, oh, as a matter of fact, here we go. Can the UAP pick up blood from the blood bank? Yes, they most definitely can pick up blood from the blood bank. And the reason why I say that is because when I was practicing, I specifically remember that question and I got that question wrong because I didn't think that the UAP could pick up blood. I thought an LPN could, but a UAP can go and pick up blood. But remember, it's only an RN with a second verification from another RN that can administer the blood. I'm dropping gems, dropping them all the time. I have this little saying that I learned in the Navy, RTFQ. We'll get halfway through the question and be like, oh, I know the answer. And I'm going straight to the answer. No. Read the question. When it comes to answering any question, you always pay attention to the modifying phrase than the original noun. The modifying phrase is at the end of the question. The original noun would be at the beginning of the question. The modifying phrase will tell you, hey, which one should I do first? Or which one is best? Or when it comes to medications, I have a patient who is on metoprolol. What is metoprolol? Beta blocker, LOL. What is a side effect of giving a beta blocker? If I am giving metoprolol, what is the first thing I should do before administering metoprolol? Your patient is on metoprolol. What is the best thing the nurse should do? And usually if somebody has low blood pressure, if I give you answers such as call chaplain, that's called what? Passing the buck. Absolutely. So we don't ever pass the buck. I'm going to do something else. I'm going to lower the bed and raise the side rails. Remember, safety. You have to read the question to see what they're asking. You have a patient who has a blood pressure of 100/60. What is the best thing that the nurse should do? Hold the meds or check the blood pressure. You could have both of those answers, but think about it. I just gave you the blood pressure in the question. I don't need to check the blood pressure because it's already there. When you read the question, don't read far into the question. Read exactly what they're asking and answer it. So the answer for that one would be to hold the medication because you already have the blood pressure right there. Just remember, select all that apply, know the content for what they're asking, answer them, know that you're going to have to answer at least one, a few, or all of them. 9 times out of 10, you're gonna know exactly which ones to pick. And here's a real good one. If you don't know, don't pick it. If you're sitting there and you're just like, well, they could do it. Nope, that's not it. That's not what they're asking. If you don't know, don't pick it. Couple of additional tips. When it comes to prioritization, stable versus unstable. What makes a patient unstable? What makes a patient stable? Easy, right? You already know what makes a patient unstable. Massive hemorrhage makes a patient unstable. Acute versus chronic. So acute means emergent, right now. happening. I need to fix it. Chronic. They've been living with this for a while. As long as they're okay, they can go over here while I take care of somebody else. Something else that's very simple. You guys know that the counter that it has where it tells you like what question that you're on, or the timer where it tells you like, hey, you have 4 hours to take this quiz or 4 hours to do this. It doesn't matter if you're using UWorld, Archer, Kaplan, Hearst, whatever. They all have them. When you take the NCLEX, it has that same exact thing. Turn them off. Something so simple can ease your anxiety. When you're practicing, you're gonna get into a rhythm. You're gonna have, it's kind of like having that internal clock where you just wake up. When I was taking my exam, I had already taken them off. And when I was practicing, I literally sat like this the whole time. And I was just click, 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 click. Before I knew it, I was already an hour into it and I was done. Another thing, it's an adaptive test. I've seen people ask, hey, what did you get on the test? Hey, I'm in a bunch of Facebook groups and I hear people ask, what did you get on the test? The test is adaptive. So it all depends on you. If you start getting questions wrong, you're gonna get easier questions. Easier questions does not mean you're passing. Critical questions means that you are passing. Those delegation, those pharmacological questions, management of care, they have to be above the line of passing. Remember that you're not perfect. You are a grad nurse. You are not supposed to know everything. You are not supposed to know what Winky Bach is, but you are expected to know what asystole is. You are expected to know what VTAC looks like, what VFib looks like. You are supposed to know the bare minimum of the bare minimum. If you don't understand what the question is asking, go read the answers and then go back and read the question. Because a lot of times the answers can help you understand what the question is actually asking. Now, time for some Q&A. First question, is there a way to find out what kind of EKG strips the NCLEX may ask about, such as arrhythmias? NCLEX itself has like 6,000 questions. If you're doing extremely well on your NCLEX, they could throw out like second degree Mobitz, or for those who don't know Wikimbach, they could throw those at you as well. There's no way to tell exactly what is going to be on it. However, you do need to know what everybody else knows, which is the basics: asystole, VTAC, VFib, SVT. Also got to know about PVCs. Can you miss all the SATA but get all the regular questions right and pass? It all depends on you and how you answer questions. First time I took the NCLEX, I swear I think I had like 45 to like 50 select all that apply questions. I had select all apply questions over and over and over and over and over. But when I took my NCLEX this last time, I had 9 select all apply questions and I was rolling through it. It's a toss of a coin, to be honest. It is literally the toss of a coin if you get select all apply questions. I've seen people get select all apply questions for the majority of their tests and still pass. It's a journey. It could be a struggle. You're gonna go the distance. And if you go the distance when it comes to these questions, that's okay. Just know that you are doing the best that you can and you're gonna push through it. How do you study pharm? When it comes to pharmacology, it's knowing your classes of drugs and knowing what families they are. It took me a while to kind of figure that out. For example, when it comes to cardiac meds, I know that anything that ends in LOL, we know is a beta blocker. It doesn't matter if they say metoprolol, propranolol, as long as it's LOL, I know that it's a beta blocker. With a beta blocker, I know that I'm looking at heart rate, I'm looking at blood pressure. If it comes to them trying to get out of bed and move, it's in regards to safety. Drop in blood pressure can make a patient dizzy, and if they're up walking around, then they could become a fall risk, so on and so forth. It's all about knowing the families and the categories for which they fall in. Depines, calcium channel blocker, right? What is the biggest thing about calcium channel blockers? It slows your heart rate down, relaxes your heart, right? Anything ending in depine is a calcium channel blocker. What about my ARBs? What are my prills? Blood pressure medication, ACE inhibitors. When it comes to studying pharmacology, know those steps. I heard that there's 15 questions that don't count. They're more as survey. Is this correct? That is true. During COVID, they got rid of those 15 questions because they were trying to eliminate the length that you had to stay in the testing center. When I took my NCLEX for the 3rd time, I only got 60 questions. That doesn't make me lucky because I've seen people get 60 questions that took the NCLEX during that time and they still failed. There are survey questions, so you're going to get a minimum of 75 questions. But you will not know what those questions are. The mentality that I want you to have is that I don't want you going into this test thinking that, oh, I only got to get 60 right. You need to go in there being like, I need to get all 75 right. Don't go in there trying to shortchange yourself, because you will never know which one of those questions is a survey question. And those questions are put there because they're test questions so they can use them in future tests. Please give an example of perfect world, as in a perfect world question. Everything is available to you. Stay with your patient. You always have the meds. You always have the equipment. You always have the help. Everybody is there. Anything that you need, doctor, whoop, here he is. Chaplain, whoop, here he is. Everything, every hand that you could possibly think of. We need to do chest compressions. Hey, guess where the board's gonna be? Whoop, right next to you. So there it is. I think I saw one question pop up there where it said anxiety tips. What I did the day before the exam, I didn't study. I didn't do anything. I put everything away, prepared my clothes, put my ID card on top of it. I took a melatonin, shout out to melatonin, and I went to bed at like 8 o'clock. That was just like really great for me, because when I woke up refreshed. You know, everybody's going to have those pre-game butterflies, and that's okay, because this is a big deal. It's a big test, and it's an expensive test. I'm not even going to tell you how much money I spent. You guys know. Just make sure that you guys have that pre-planned out for yourself. I sat and I watched, I don't know, I think I watched anime.
Attack on Titan is ruling right now.
That's what I did, at least for myself. Some other people, they go work out. One girl I know, she went to a hotel and she stayed there by herself and left her 3 kids and her husband at the house. She was just like, sorry, I don't know what you want from me. You're gonna take care of the kids and I'm gonna be doing my thing. There are multiple ways to do it. The one thing I will say to not do is drink. Don't go out there and drink and party and thinking that you can do X, Y, and Z, because that ain't it. Try to relax the night before and just know that you're gonna be okay. You're gonna be totally fine. Do we get something to write on when answering questions or doing math? Yes, you do. They will give you a marker, as well as they will give you a like a laminate sheet, and you get to write on it. The only thing is, you can't erase it. They have to come and take it from you. So everything that you do, they'll provide you. You'll get a marker, and then you can data dump. Data dump it. Like if you know whatever little things that you need to know, write it. That way when it comes, boom, you know whatever little ditty that you use to help you remember, you know, your pharmacology drugs.
Hey, man.
Or if you know, like your the roles and responsibilities for a RN, LPN, and a UAP. Yes, you do get a calculator, but the calculator is on the computer. Will there be COVID topics on the NCLEX this year? No, there will not be. Now, if you want to know the most up-to-date information when it comes to the NCLEX, make sure you guys check the ncsbn.org website, because they give the most up-to-date information on what is going to be on the test. It's a long document. No one ever reads it. It's kind of like when you agree to Apple's terms and services. Nobody reads it. They just click agree and then they just go on about their day.
No, you didn't read it. This says we don't ever have to let you out, and then we can do whatever we want. Damn it, why won't it read?
If you want to know that answer, you got to go and you got to read that document. I'm a repeat test taker. I started learning Kaplan decision tree in March, but I noticed that my scores have gotten worse. Tips on how I can improve my score. Here's the thing about the decision tree. If you've been studying away for a long time, it's kind of like trying to teach an old dog new tricks. You have to trust that process if you're going to be using Kaplan. When I first did the decision tree, I was doing horrible. I think my first exam, I got like a 46. And the next, I had a 47 and a 48. And then by the time I was probably like 10, 12, 15 quizzes in, I was getting 54s, 55s. Then I got a 67. And then I stayed in the 60s the entire time. And then at some point I ended up getting like high 50s, low 60s. So you just have to trust the process when it comes to using the decision tree. You can use the decision tree on anything. If you got UWorld, Archer, whatever, you can use it. Are there doses calculations questions? Yes, there are. On this last time when I took the exam, I didn't get any, but the first 3, I got a couple. There's some people I know that don't get any. There's some people that get a lot. There's one girl I know, she only got 2. And she was just like, I wish I would have had more because I'm a math whiz. And I was just like, well, some of us don't math well, Rhonda. Go on and do your math somewhere else. What do you think about UWorld? Look, let me talk to you about UWorld. UWorld is fantastic when it comes to the rationales. However, UWorld only provides questions and rationales. If you are a person who is lacking content, and by content, I mean the stuff that's in the book, so you can understand, it is not going to help you. I used UWorld the first time, the second time, and the third time, and it just didn't work for me. What did work was Mark Klimek and Kaplan. It depends on you. If you know content, get you a test bank. save yourself the money if that's what you want to do. But if you know that you're lacking content, get you something that can provide the content and everything. Like some of us got to be, hand walked. Me, Kevin, I had to be hand walked. For some reason, the last time it just clicked. And then when I passed, I was like, oh, that was easy. And then that was short-lived because now I'm trying to figure out what else I want to do in my life. It all just depends on you. Do you recommend taking the RN practice test on the NCSBN website? The NCSBN, they're the ones who make the test. What better place to get the test or a practice test than from the source? Sometimes it could just be that easy. I personally didn't use it. When COVID had broke out, they were, kind of just making, putting stuff on halt. NCSBN was giving their stuff away for free for like 30 days. I think now, like everybody is starting to kind of like, hey, give us money now. It all just depends on you, if you have the budget for it and if you want to do it. I know this is a stressful time for everybody, but I appreciate you guys taking your time to come and just kind of listen to my story and try to give you guys some tips and whatever that you guys needed to get from this, either if it's motivation or if it's just reassurance for the fact that you can do this. And I'm telling you right now that you guys can do this. If you guys ever want to talk to me, you guys can find me at The Boot Nurse on Instagram, and I have one on Facebook. If you guys see me on Facebook groups, just go ahead and give me a shout out or go ahead and talk to me. If I don't see you before then, I'm going to tell every single one of you guys, congratulations. Welcome to being a registered nurse or a licensed practical nurse. I will see you guys out there later.